Hello, everyone. Good morning. Here in Mexico, it's 7 a.m. And in India, I believe it's about 6 o'clock in the evening. I'm Dr. Jessie Schwartzberg, and it's my pleasure to share this talk on Hypersculpt with you. Please write down any of your questions, and at the end, we'll be happy to answer them. But I'd rather wait till the end so that we can actually answer some of them as the talk is going on. So today we're going to talk about Hypersculpt, but before we do so, one moment. But before we do so, I'd like to talk a little bit about how our ideal body image has changed. And in Mexico, at least in Latin America in general, we've seen a huge change in body image, or the ideal body image. And I like to give this example in soccer players. What we used to feel was normal for an athlete to look like, with this picture of Maradona. And then what's happened over the years, now we're looking at Cristiano Ronaldo, who is so much more athletic and so much more muscular looking. And it's not because they do more or less as far as athletics go, as far as soccer goes anyway, but this is mostly because Cristiano Ronaldo himself says he does a lot of body contouring work and a lot to create this muscle tone because he's interested in looking this way. And that's because this is the style, this is the ideal body image we're looking at. In fact, he even admits that he does a lot of treatments to his face. So men have become way more interested in what they look like. And if that's the case with men, well, with women, one moment, our slides aren't moving. With women, it's even more. Look at this image of Marilyn Monroe. This used to be the ideal body image for women, not just the face, but of course the body. And how this has changed. I mean, with all due respect to Marilyn Monroe, compared to what we look like today, she's a bit rounder, she's a bit more flaccid, in fact. And if we look to the other side at Giselle, who's now our ideal body image and what girls and women are looking up to, it's a body that's a lot thinner and also a lot more toned. And if you asked me years ago what I thought of the body in the middle, I would probably say that this is an unattractive body, that this is a body that looks very masculine to me. But nowadays, this is the norm. We're looking at more athletic women that are trying to achieve not just to be thin, but also to be toned. So this is the attitude I'm confronting every day with my patients, and their empowerment, which for them is exactly this phrase. It's every day is another chance to get stronger, to eat better, to live healthier, and to be the best version of you. It's not enough just to be thin. Now we want it to really show that we're working out and that we're toned. So that's how Hypersculpt is born. This is the first non-invasive technology to achieve both muscular hypertrophy and hyperplasia, and at the same time, adipose reduction. This works through electromagnetic energy at 3 Teslas of intensity, and we're going to talk about that a little bit further on. And we use hypermaximal contractions, which are an equivalent to 20,000 contractions in 30 minutes of treatment. So now we're going to look at a video so you can see how Hypersculpt works and you can see it in action.
Виж какво прета? Нещо стана? Що рек? Става да види.
Okay, so let's talk a little bit about the basics. So 40% of the human body is muscle, and this is more in men than in women. And the percentage of muscle reduces with age, along with the capacity of contraction also reduces with age. So this is why we're seeing people that are frustrated that can't create the amount of muscle that they'd like. And as far as adipose tissue goes, this is 15 to 25% of the human body. And this is the other way around. It's more present in women than in men. And as we all know, adipose tissue has metabolic and mechanical functions that we're not going to talk about right now, but they're basic, so we can't get rid of fat completely, but we definitely want to reduce it to the minimal amount. So how does Hypersculpt work? Well, we're not engineers, we're doctors, but we're going to talk a little bit about electromagnetic fields that we all know a little bit about because there's so many other devices that also use electromagnetic fields. So not to forget that electricity, this is the basics, is the sum of phenomenons that are produced by the movement and interaction between positive and negative electric charges of physical bodies. And that magnetic energy is a natural phenomenon by which objects produce a force of attraction or repulsion over other matter. And all of us are used to hearing about electromagnetic fields when it comes to MRIs. This is probably the classic example. When the intensity of the magnetic field is measured, we're talking about units, about Teslas. And that's why we talked about how Hypersculpt uses 3 Teslas. And in the case of an MRI, we can also be using about the same amount, up to about the same amount. And in fact, if we're doing a full-on scan, we can actually use more of an intensity as far as Teslas go. And I would say that the most important point for doctors before even efficacy is making sure that we have safety, that our patients are safe when we're doing these types of procedures. And that's why I dedicated a full-on slide to this, because it's important for us to be making sure that our procedures aren't going to harm our patients. So as you can see, this procedure is not ionizing. This means that it does not transport enough energy to ionize molecules or to affect the cellular structure. Also, it's not radiant, like an X-ray would be, for example. This does not emit radiation. It's not thermal, so there's no heat. It's not producing any thermal energy. And it's selective because it does not affect sensory nerves. In other words, it's designed to only stimulate the motor neurons of the voluntary skeletal muscle. This is important because since we're placing it on the abdomen, we of course don't want to be affecting any organs. We don't want to be affecting the muscle in the intestine. We don't want to be affecting the uterus, for example. So this is very important as far as safety. Now, how does it work? So on one side, you see the images of what would happen in what we all know as a normal contraction. In other words, the brain first has to signal the spinal cord, and then the motor neuron, and then the axon, so that we can have a contraction in our muscle fiber. But when it comes to Hypersculpt, we're pretty much skipping all these steps, and we're going straight to an electromagnetic field with hypermaximal intensity that's going to introduce the electricity into the tissue, causing a depolarization of neuron membranes into the muscle, and it takes complete control of the muscle units in the muscle, causing a contraction. So we're skipping all the regular steps and going straight to the contraction on the muscle. And so now let's talk a little bit about what are supramaximal contractions compared to a normal contraction. So when we go to the gym and we're doing a normal contraction, we're going to have a relaxation between each nervous stimuli. This is not something that we can skip. It has to happen. There always has to be this relaxation with a normal contraction. And also voluntary maximum contractions when we're at the gym only last a fraction of a second. Even though it feels like a lot longer, it's not longer. When it comes to a supramaximal contraction caused by Hypersculpt, in this case, impulses are independent from the cerebral function. We just looked at that image. So because of this, there's no relaxation phase. Our Hypersculpt machine can take complete control. And the contraction lasts various seconds instead of a fraction of a second. This causes physiologic stress, and this is such a large burden that's augmented in our muscle that the muscle has no choice but to adapt. and to create what we know as muscle growth or muscular hypertrophy. Also, the number of muscle fibers augment, so we're going to have muscular hyperplasia, and clinically this is going to show as definition and muscle tone in our patient. But what about the fat? This is something that people are very interested in as well. Even though we talk a lot about muscle definition with this machine, machine is also very effective for reducing fat. So what happens with the fat? The supramaximal contractions will generate such extreme activity that this is going to go the other way around, and it's going to signal the brain of an imminent demand of energy. Thanks to this, we're going to have an increment in epinephrine secretion, and this is going to take us to lipolytic catabolism. Because of this, all the fatty acids are excreted at an elevated rate, and it's going to accumulate, or they're going to accumulate in the adipocytes. This is going to cause malfunction and apoptosis caused by the excess of all these fatty acids, and also, very importantly, by the augmentation of circulation at the site. This is going to take us to punctual lipolysis in the area of the muscle that was treated. And this is a very important point. We're going to have augmentation of circulation. In other words, we're going to have angiogenesis and neovascularization, which is also going to help in a major way. And we're going to talk about that a little bit further. Here, I always like to talk a little bit about the buttocks, because at least in Latin America, it's very important for us to not reduce the fat in this area. And because this is an area where the fat is less metabolically active, we won't have that loss. We'll only have the increment in muscle in this specific area. So who is this device indicated for? Well, we're using it mostly in aesthetic medicine right now, but there's many other indications that we're going to talk about. So we're using it for muscle strengthening or muscle building, for muscle re-education, also for fat loss, and not to forget patients that have a hard time doing exercise, not just those that are looking to be extremely fit, but also those that have a hard time doing exercise. So we can also talk about other indications when it comes to rehabilitation, when it comes to orthopedics. You can think about a bunch of other indications, which we're also going to talk about, gynecology, urology, and sports medicine, of course. So when it comes to gynecology, why is this helpful? Because we're going to have a stimulation or a profound stimulation of the pelvic floor muscles. Also, we're going to have restoration of neuromuscular control. This is going to help us also in patients with incontinence. In fact, now Hypersculpt has a specific device that can be connected to our normal machine, and this is used specifically for incontinence. Also, let's think about patients that have suffered fractures, that it's so important to be able to build muscle if we're fractured and to be able to sustain and to be able to recuperate. Same thing happens when it comes to osteoporosis. Wouldn't it be fabulous to be able to give our elderly patients some muscle tone? And also don't forget about fibromyalgia, arthritis, chronic fatigue, and all the importance that muscle has in the body. So how do we do this to our patient? You've seen how it works in the videos, but how is it done to begin with and from beginning to end? So the first thing we do is we remove all the metal from our patient. In other words, we remove all the jewelry, and then we're going to apply the pallets to the area that we wish to treat, directly on the abdomen, on the buttocks, on the legs, on the arms, wherever we're going to treat. And this is going to be held by a Velcro. It's kind of like a belt that holds it. And little by little, we're going to augment the intensity until we get up to 100% intensity. And after that, we're just basically going to keep it on our patient for about 30 minutes, which is equivalent to 20,000 sit-ups or squats. This point is important. It's not operator dependent. In other words, of course, we have to have someone that knows what they're doing to be able to apply the machine. But once the machine is applied and our patient is comfortable, we can actually walk out of the office, or we could be doing another treatment, which I find very interesting. In other words, I could have someone do a facial to my patient while they're getting their abdomen treated. So we can augment our income by doing two treatments at the same time. And also the fact that we can walk out allows us to see another patient. So I think this is an important point. How many sessions we're going to do completely depends on patient expectations and where they're starting from. So it's not the same if we have a patient that has a large amount of adipose tissue as to a patient that has a flat abdomen. It's going to be completely different. But what I do, and what most doctors do, is they do about 6 to 8 sessions in a package, which means that they're doing about 3 sessions per week. And this is going to take our patient to the next level. In other words, if we've got a lot of adipose tissue, we're going to reduce adipose tissue and probably see some muscle toning even with the adipose tissue, which is what most patients say or notice. And in the case of patients that are completely flat or have a flat abdomen, what we're going to notice is they're going to start having the muscle tone that they're looking for, maybe a 2-pack. And after having this 2-pack of muscles, the more they do, of course, they're going to develop more. And this depends completely on what the patient's expectations are. And then we can do additional sessions, as many as the patient would like. And then once we've achieved our goal, we can do maintenance treatment. So this is interesting for us as doctors to keep our patients on this machine. Now, a lot of people ask the difference between Hypersculpt and electrotherapy. And at least here in Latin America, a lot of trainers use electrotherapy on patients because while they're doing exercise, it becomes extra effective if we're using some electrotherapy. And those of you that don't know it, it kind of looks like a vest that is used on the upper and lower body, about above the knees. But in this case, the depth of penetration is completely different. The type of contraction is different. And of course, the results are different. Hypersculpt is way more intense and way more effective than electrotherapy. And you can't be doing exercise at the same time because we're taking our muscle to the hypermaximal contraction. As far as adverse effects go, this is very minor. Patients can complain of very minor pain. Usually they say there's no pain, but this also depends on how much adipose tissue we have. So if there's a lot of adipose tissue, of course, the palate isn't stimulating directly on the muscle, or not as directly as if the abdomen is completely flat and there's no adipose tissue. So it kind of depends on that, how much of a sensation we're going to have. But this is very, very tolerable. There could be a bit of a muscle spasm, which a lot of patients already have when they do regular exercise. So for the most part, people that already have muscle spasms when they do exercise might have some with Hypersculpt as well. The company says that there could be temporary pain of the articulation or the tendon that's close to the Hypersculpt application. I honestly haven't seen any patients have this kind of discomfort. And we also talk about local erythema, although I have to say this is not a machine that uses thermal energy. So because of that, in reality, the local erythema is really just because we have the palate on top of the skin. But this is actually what patients talk about. They say, I feel thirsty and I feel like I just worked out once they're finished. So this is really great. I like patients to feel like they've done something. They can really feel that they've just had a treatment done, and that's fantastic. And absolutely, they need to drink a lot of water because they have done exercise. Now, how about lactic acid? This would be a good question to ask. So do we or do we not generate lactic acid? As you can imagine, after doing 20,000 sit-ups, you would expect to have some pain. And that's not the case with Hypersculpt, or if it is, it's very minor. So don't forget that lactic acid is generated because of anaerobic glycolysis. In the case of Hypersculpt, we have such extreme oxygenation of the treated area caused by what I mentioned earlier, the augmentation of the microcirculation and the large-scale vascularization that occurs, that because of this, having oxygenation means directly that we can't have anaerobic glycolysis. Therefore, if there's no lactic acid, we shouldn't have pain. And what about rhabdomyolysis, which I've had doctors ask about? So thinking back to internal medicine, rhabdomyolysis is caused by the destruction of skeletal muscle, which liberates myoglobin, electrolytes, and muscle enzymes into the bloodstream. And the etiology is overexertion, injury, alcohol within others. And the symptoms, you might remember muscle pain, debility, darkened urine, kidney failure, among others. And what happens with Hypersculpt is, don't forget, there's no muscle damage. There's no rupture. Therefore, the hypertrophy is caused by the supramaximal contractions and the angiogenesis, and not by the destruction of muscle. So therefore, we should not have any kind of risk of rhabdomyolysis. As far as the contraindications, we divide these in absolute and relative. So of course, as you all know, pregnancy is of course an absolute contraindication to most aesthetic procedures, but definitely epilepsy, and more importantly, all these that follow, which is the pacemakers, electronic or metallic implants, basically anything electronic that could interfere and that we could have an adverse effect. Also, proximity to metallic prosthetics is a major contraindication. And don't forget that IUDs in women, if they're metallic, because now we also have plastic ones, but if they're metallic, is a contraindication because it is a metallic prosthetic. Defibrillators, implanted neurostimulators, but also others, as in coagulopathies, anticoagulant therapy. Presence of malignant tumors is just basic information that we need to know, that of course we're not treating sick patients in aesthetic medicine. Fevers of unknown origin would obviously be a contraindication, or a cardiopathy. But how about relative contraindications? Well, basically a recent surgery. Don't forget that a lot of these patients might have done even aesthetic surgeries. So in the case of, for example, liposuction, if a patient had liposuction without this new high definition liposuctions, well, they might be interested in Hypersculpt. In this case, we have to wait 3 months to be able to do this safely. Another issue is menstruation. This is not a real contraindication because we already talked about how the uterus is not actually affected. But in the case of menstruation, when women are menstruating, even when doing exercise, we can have more bleeding. So the idea is not to scare our patients. I would say skip menstruation and do it right after menstruation is finished. As far as children and the elderly, well, this is definitely a relative contraindication to decide exactly at what age to start or what age to stop. But I would say there's many elderly patients nowadays that want to achieve more muscle. We know how important it is to have muscle, not just physically and not just because of its aesthetic reasons, but metabolically. And there's many elderly patients that actually look a lot better or feel a lot better and are a lot healthier than our younger patients. So this depends on each physician, depending upon the state of our patient. And what about duration of results? So we all know, because we all do aesthetic body contouring, that this depends on lifestyle. But let's say that we're not doing any maintenance of Hypersculpt. And don't forget, in the case of Hypersculpt compared to the competition, here we're looking at doing maintenance because these are patients that want to really keep their results. So let's say we have a patient that's just going to maintain their diet, just going to maintain pretty much whatever they are doing already as far as exercise is concerned, and they've done some Hypersculpt sessions and they decide not to do anymore. Well, they're going to maintain their results as far as fat loss, at least 3 to 6 months. And when it comes to muscle gain, at least 6 months. Considering that they're not doing any more treatment and just maintaining their exercise, this is really quite good. So here's what I call the $1 million picture, or maybe I should say the $100,000 picture. This is myself. This is my abdomen before and after the treatment. This is when I was trying out the procedure and deciding if I really thought it was worthwhile for my office and for my patients. And I kind of honestly in the beginning thought, well, why do I care about having a marked abdomen, a toned abdomen? I already had a flat abdomen, and I really wanted to see if it was worthwhile. And once I saw the result after 8 sessions, I was really impressed and really felt like there's a total difference between a good body and a beach bikini ready body. So I was really happy with the results and ended up buying the machine. After doing these 8 sessions, interestingly enough, I found out I had to do a hysterectomy. And this was late in November last year. So I was really upset that I was going to lose my results. And but I kind of took advantage of this to see what would happen. Would I maintain my results after the hysterectomy. So what happened after the hysterectomy is my gynecologist asked me not to do exercise for about a month and a half, 2 months, which I didn't. And then after that month and a half, I started doing just my regular exercise, and I didn't do hypersculpt in the abdomen. I did hypersculpt in other areas. I took advantage of doing in other areas. And right now, well, this was from end of November till now, so we're almost at 6 months, and I'm going to show you my next photograph. This photograph is showing you my after results when I had finished with my 8 sessions of hypersculpt in November. And the other picture, that's a little bit darker, unfortunately, but you can see clearly that this is my photograph of about a couple weeks ago. I haven't done any more hypersculpt on my abdomen. It's almost 6 months. And so as you can see, even though I've maintained my healthy diet, my healthy exercise, I've maintained my hypersculpt results. So I'm very, very happy to say that this is absolutely true. So looking at some more patients, this is one of the first patients I treated. She had a lot more adipose tissue than I did. And you can see how beautiful the results are. And not only did she reduce adipose tissue in these 8 sessions, but you can see how her abdomen is really starting to become toned. This is her side view, and it's even clearer how the adipose tissue reduced quite significantly. This is a patient who was treated in the buttocks area. And what's very interesting about this picture is how, look at her legs. Even though this was applied on the gluteus, it's to be expected that as soon as the buttocks lifts, we're going to see that the leg also appears better because it lifts as well. And so the side of the legs look so much better, and also how nice it looks as far as skin tone, as far as skin quality. And this makes total sense, even though the company is talking about how we're just going to get muscle tone and we're just going to get some fat reduction. In this case, really all we were looking to achieve is muscle tone. But you can see how the skin quality is so improved. And why is this? It makes sense to us as doctors because we know that the circulation is augmented, and we know that cellulite and all this skin quality result has to do with the neoangiogenesis. Here's some other pictures of patients that are, this is a patient that has a pretty flat abdomen, but he got even thinner and some more muscle tone. This is a patient with a little bit more adipose tissue who lost quite a bit of adipose tissue. And you can see how even these patients start having this muscle tone. Okay, this is the side view. It's another patient that already had a flat abdomen, but as you can see, it even flattens out a little bit more, and you can see how the definition happens. And don't forget, this is just one package. This patient could continue and get a 6-pack. Okay, this is a case where you can see clearly how only adipose tissue improved. But if this patient continues, she'll definitely have more of an improvement and keep getting better. Another patient who is pretty thin but has a little bit of adipose tissue, and you see how at the lower abdomen you can tell how adipose tissue really dropped, and there's more muscle tone. And this is a nice picture that I took from a study that was done, a really nice study, where they showed the difference clinically, and they also did ultrasound. So you can see the before and after as far as the ultrasound goes, and the reduction as far as adipose tissue is 35%. This is huge. This is probably even more than we see with cryolipolysis. And also we know that underneath muscle is being stimulated. So this is a huge result. And even though the company talks about around a 20% reduction in adipose tissue, you can see how this will depend on each patient. This is probably a young patient, so this is why we have even better results. And it also depends on their diet and their lifestyle. Don't forget that while you're doing hypersculpt, you should be continuing your exercise. And this is another young patient who the results are really quite nice as well. And you can see this is a 36%. So sometimes it's not even as visible clinically as it is when you look at an ultrasound. And in the future here in Mexico, we're planning on doing a study. Once all this is over with the coronavirus, we're planning on doing a study with the MRI so that we can be even more exact. So here's some more before and after pictures. Again, more patients with excellent results, more muscle tone. When it comes to the buttocks, look how nice this is. The buttocks has lifted, and not only has it lifted, but the quality of skin has improved so much. Again, not just to look at the gluteus, but also to look at the leg, even though the leg wasn't treated, how much better the cellulite looks in the skin quality. And also the lifting again and again. So this is a very important slide, probably one of the most important slides, because it's very important to compare what we have on the market. When it comes to deciding what machine, what device you're going to buy, you definitely want to make this comparison. So this is very, very important to look at. See how Hypersculpt has 3 Teslas as far as intensity. It's almost double the intensity of the competition. Also, a lot of us consider it important to know that this is a device that's been on the market for a while, which it has. Hypersculpt came out in 2014, whereas the competition came out between 2017 and 2018. Hypersculpt will cause a muscle hypertrophy of about 20%. This is what the company says, but of course, don't forget that we could have more considering and depending upon each patient, age, et cetera, other factors. And the competition reports about 19%, so there's not a huge difference here. But as far as fat loss, there's a considerable difference. When it comes to Hypersculpt, it's 22%. And when it comes to the competition, it's 16%. But I already presented some cases where it can be up to 36% in Hypersculpt. So as you can see, it can definitely be way more. And this is probably the most important point of all. There's no consumables when it comes to Hypersculpt, and there are consumables when it comes to the competition. And for me, this is so important. In other words, when I'm going to offer promotions, when I want to do discounts, when I want to give patients a test trial even, I mean, patients love to be able to test out a device, and we can do that when it comes to Hypersculpt, and that really helps with our sales, whereas the competition does not offer us this option. Also, this takes us to a different mindset when it comes to Hypersculpt. We're thinking about a continuous treatment method because it's more plausible, honestly, when you don't have consumables. You can really play with your prices, whereas the competition recommends 4 sessions. Of course, I'm sure they'd be happy to let you do more sessions, but it becomes very expensive because of the consumables. And so this is really the main point. When it comes to cooling, this is another really important point. If I can use my machine, my device all day long, I'm much happier than if I can't. So if I have efficient cooling, then I can do continuous treatments without being concerned that my device might fail. Whereas this is not the case with the competition. We need to have some space, some time between patients, and that just means that we're going to be able to see less patients. So we always want to see more patients. Another thing that's very important is that Hypersculpt has modifiable programs. Don't forget that when you're playing with your new toy, you want to be able, in the beginning, to really follow exactly what the company says. But we all know as dermatologists that we like to start playing with our machines and doing different things. And of course, as time passes, for sure we'll have new protocols. So we really want to be able to modify our programs. Whereas with the competition, there's only certain pre-established programs. They're not modifiable. With Hypersculpt, we have 8 pre-established programs because we're talking about not just aesthetic medicine, about other indications. We're also talking about rehabilitation. And again, we're able to modify this. So in conclusion, who should have this device? What physicians should really be looking at getting this device? Well, those who are looking for a different machine, a different type of device, a novel type of device for body contouring. It's also important for our patients to see that we're up to date, we're in all the new options, and that we can also start treating muscle. And this is something that I hadn't been able to do in the past. We were really only treating flaccidity, we were treating adipose tissue, but we weren't, certainly not treating 2 things at once, and we weren't looking at muscle, and I think muscle is really just so key. Also, for those who want to offer a treatment that gives excellent, sustainable, reproducible, and fast results. I mean, think about, this is 8 sessions to be able to see important results. So, I mean, if you're thinking this is 3 sessions per week, we're talking about 2.5 weeks. That's faster than pretty much any device. Those who have demand for non-invasive treatments of the gluteus is a hard area to treat. What else do we have? Of course, there's radiofrequency to help us with flaccidity, but we can't forget about muscle. It's so important in that area. And of course, now there's a lot of usage of Sculptra, especially in the United States, but don't forget about the consumables. Sculptra is extremely expensive, but those of us who can have some patients that do Sculptra, well, why not combine? And I've found excellent results when I combine Sculptra and Hypersculpt. Also, those who have had to reject patients because they are not candidates for existing treatments, which happens a lot, and this is an excellent option. And finally, those who have patients with high expectations, I think that's all of us, for both fat loss and muscle building, especially considering the huge expectations and the body image that we've been talking about, this ideal body image, the empowerment that our patients have. I think this is an excellent device for all of us who do body contouring. So I thank you so much for your attention. This is my email if anyone wants to contact me. Of course, I'm going to take a look at what questions we have, and I'm going to answer them. So please, if any of you have any extra questions, please write them, and I'm going to try and address them all. Okay, so let's look at our questions. Okay, it seems that so far we don't have very many questions. I'm waiting to see if anyone wants to ask any questions right now. Hold on a moment. Okay, so people are asking if 6 abs are possible. In other words, I'm guessing that what we're talking about here is if a 6-pack is possible. Absolutely. It depends on how we're starting and how many sessions we're going to do. So like I mentioned, if our patient comes in with a flat abdomen, absolutely. Every person's a little bit different, and of course we have to look at diet and that people are having an adequate protein intake, but absolutely we can get a 6-pack. So of course, if a person is starting with a lot of adipose tissue, let's not promise them that they're going to have a 6-pack in 8 sessions. If they have a small amount of adipose tissue, well, you saw one of my first patients that were treated, she didn't have a huge amount, but it also was significant. And for sure, within 8 sessions, she had quite a flat abdomen. I mean, maybe not completely flat, but quite flat. So I'd say another 8 would take her to a flat abdomen. And after that, we're going to start seeing a 2-pack. And then after that, we're going to see a 4-pack and then a 6-pack. Of course, this is something that men ask for more. Generally, women are pretty happy with a 2-pack. Otherwise, it might look a little bit masculine, but absolutely, yes, we can achieve a 6-pack. Let's see what everyone else is asking. Okay, so how many sessions are required? We were talking about how that completely depends on our patient and how our patient has started and what our patient's expectations are. So if someone's just looking to reduce a little bit of adipose tissue, I would say just the 8 sessions. Don't forget that some doctors offer a 6-session package. It depends on what you want to do. For me, I offer 8 sessions per package because I don't have consumables. So I want to make sure I get that fabulous result so that patients get really excited and maintain this treatment, keep doing it, and get better and better results. But let's say you're going to get to your next level, whatever that next level is for each patient, after 8 sessions, after between 6 and 8 sessions. So once 6 to 8 sessions have passed, we reevaluate our patient and see what we want to achieve. And don't forget, we're thinking of Hypersculpt different to our competition. We're thinking of it as being a treatment that you just keep doing. So even I've heard in Colombia, people do it every single day. There's really no reason not to. So I think in the future, people are going to do it even more often. I guess it also depends on what you can pay for, but you can really keep going. Okay, so the next question is, can you apply Hypersculpt on the chest region? In men, yes, you can, absolutely. This is a popular area, and what I like a lot about doing the chest is that when you try Hypersculpt, you're going to notice that even though it's applied in one area, it's definitely going to also treat other areas that are close to it. So when men do their chest, they notice that they're also contracting their arms because of the supramaximal contractions. They're so intense that they also tend to get a bit of muscle tone in their arms. But yes, to answer the question, absolutely. Whereas when it comes to women, I do not suggest you using this on the chest. People are also asking if we can use this on the face for a facelift. No, we can't do that. This is just a body contouring device. In fact, the palettes are way too large, and this is not something I recommend. How is it different from cryolipolysis? Well, it's completely different. It's a mechanism of action is completely different, even though cryolipolysis will also cause apoptosis. There's so many differences. Cryolipolysis is using freezing. In this case, we're using muscle contraction. Also, when it comes to cryolipolysis, you're doing at most one session per month. Here I can do a lot more sessions. And I would say they're similar in the amount of fat reduction, but it just depends again on the amount of sessions. You can get a lot more out of this machine if you keep using it. And considering that you don't have the consumables, I think it's definitely viable for people to continue their treatments. The next question is, how is it different from radio frequency and ultrasound? Okay, so as far as radio frequency, don't forget, radio frequency is only for flaccidity. That's all it's good for, which is fantastic, of course. And of course, we can combine these treatments, but radio frequency isn't going to help us really reduce a lot of adipose tissue at all. It's mostly, I mean, we'll have a little bit, but mostly it's for flaccidity. And also radio frequency is not going to treat the muscle. Also, as far as ultrasound goes, well, yes, ultrasound does touch a tad bit of the muscle. That's true. And in fact, it's even used on the face for that reason. But this is much, much stronger when it comes to the muscle. It says, which type of patients are not going to have good results? I have to be honest, I've seen really good results with every patient. I've been using this device since last year, and everyone, literally, I don't have a single patient that hasn't been happy. But of course, just like with other body contouring, I would say patients that maybe don't have the best results or would stay, let's say, exactly the same would be a patient that's taking advantage of the fact that they're doing a body contouring procedure and eating more than they actually usually do, which happens to all of us. I have seen this type of patient, which is really, really lazy. In fact, now is feeling like they can eat whatever they want. And so what's been interesting to see in those patients is that they pretty much stay the same as they are. So, but that's obviously not our ideal patient. We're looking for someone who's looking to get to the next level. Okay, as far as incontinence goes, this will depend on the patient. It will depend on their diagnosis. It'll depend on the urologist. Honestly, I haven't started treating incontinent patients yet. This is my plan for once I can get back to work, to start teaming up with urologists. And but yeah, there's lots of articles that we can give you, and you will have a result within these first 8 sessions. Can we add it in for laxity? Okay, so as we were mentioning, mainly this is for muscle tone and for reduction of adipose tissue, but you noticed how skin quality improved. And that's because as soon as we stimulate muscle tone, and as soon as we create all this neovascularization and all this oxygenation, for sure we'll have some improvement. I mean, it definitely seems like patients are more compact, but it's not in reality a treatment for laxity. Okay, so how to make patients convinced about side effects. I'm not sure what the exact question is, but I'm guessing how do patients feel about their side effects? Okay, literally I've had almost no side effects. Some patients say that they're feeling well, like they've worked out. That's something that patients actually like. They feel thirsty because they've done intense exercise. But other than that, really, they don't complain of, I haven't had any complaints. I myself once had a bit of a muscle spasm in my leg, and but that happens to me when I do regular exercise. So there's really no, honestly, adverse effects. What I have seen is patients that have prosthetics that I can't apply the machine on top of the prosthetic area, which is unfortunate, but I can apply it to other areas. So let's say they have a prosthetic on their leg, and I do the abdomen area, that's fine. Any cramps after treatment or lactic acid accumulation after treatment? Okay, so we mentioned in earlier slides that in order to have lactic acid, you have to have anaerobiosis. In other words, you have to have a lack of oxygenation. So we don't create lactic acid. That's really what's so amazing about this machine, that there's no lactic acid, even though you would expect to not be able to literally sit up the day after doing 20,000 sit-ups. Truth be told, you have minor sensations on the day after. You feel like you've worked out, but minimal. And to be honest, some patients don't even have that sensation. Like I said, you could have some muscle cramping, but I really haven't had any patients complain of this. It says, how come for orthopedics? Well, let's not forget that, here, let me give you a perfect example. My husband had knee surgery, and don't forget that after knee surgery, especially in patients that are very athletic, they really notice a huge difference, and it's amazing how fast they notice a difference on the side that was operated, how their muscle becomes atrophied. They really lose a lot of muscle tone, and they can't get back to regular exercise very quickly. So it's really fantastic to be able to treat either both sides at the same time or just on the side that's been operated, and they rehabilitate so much better. And I actually know of teams of doctors here. For example, I know of a plastic surgeon, and his sister is, she does rehabilitation, and they've kind of teamed up to be able to use this product, this device together, because it's so fantastic. Don't forget how important muscle tone is to rehabilitate. I mean, if a patient has osteoporosis or any kind of bone debility, it makes all the difference in the world. Doctors, in fact, will always ask you to really do a lot of exercise before you're operated on. And then after, whenever you can start up again, to get back to doing exercise, because the muscle tone is so important. So that's why it's so important in orthopedics and sports medicine and rehabilitation. It says, how long a session for abdomen? So any area that we treat is 30 minutes. And that's all you need per session. After 30 minutes, the patient's done and they feel normal. And in fact, they can do the regular exercise. So just 30 minutes. And that's not just for abdomen, that's for any area we treat. Another important question that so far no one has asked me is if we can do 2 areas in one day, or how many areas we can do in one day. So we can do 2 areas at most, for example, the abdomen and the gluteus. I mean, I've talked about these 2 areas more than anywhere else, mostly because these are the popular areas. But of course, I've had patients doing their legs, doing their arms, pretty much any area you can think about. Now we're using it on the back as well, and on the chest in men. It says, how effective is it for post-pregnancy bulge and skin laxity? Okay, so again, it's not really for skin laxity, but it will assist, and we have seen improvement in skin quality. As far as the bulge, absolutely. A lot of the bulge has to do with lack of muscle tone and muscle stretching. Don't forget that this is what happens to patients after pregnancy. The muscle stretches along with the skin, along with everything else. And so absolutely, to get back into shape, this is absolutely a fantastic treatment for moms. Okay, so it says, do you have some protocols for counseling for this? Well, basically, the protocols are pretty straightforward. You apply the device directly on the area that you would like to treat. You do 8 sessions. Never promise a patient that after 8 sessions, they're never going to need another session. They're never going to do anything else. Why? Because it just really depends on how the patient started. And very few patients come in being so perfect already. So we generally need more sessions. So the protocol that I recommend, I know some doctors include 6 sessions in a package. My protocol is I do 8 and I reevaluate. Of course, before these sessions, I'm taking photographs, both in the front, on the side, and the back, depending on the area that we're doing. If it's the gluteus area, you have to be extra careful taking really good pictures, because it's hard to prove, even though it's visible and the patients feel this tightening, it's hard to prove the lift. So you really want to be able to draw a line and be able to show patients how it lifted. But because of how it works on the legs as well, you can really show a patient how their gluteus lifted. So the protocols depend on each patient and each patient's expectations. Does it work for stretch marks? Well, as you saw in some of the photographs of before and afters, it would appear to. This is not what the company is promising. They're promising that you're going to achieve muscle tone and that you're going to achieve a reduction in adipose tissue. However, I mentioned that we're going to get an improvement in skin quality, and I've been honestly impressed and surprised at how much we can really improve thanks to all the extra neoangiogenesis that is created with this machine. And the oxygenation makes sense for it to improve both stretch marks and cellulite. It says, does it work on collagen remodeling? Absolutely. That's what I was just talking about. We're going to get stimulation of collagen just because of the fact that we're oxygenating so much. Okay, so how many inch loss can we expect in about 8 treatments? Okay, so more than inch loss, I've been talking about percentage-wise, kind of similar to cryolipolysis. The company promises about 20%. I would say I've honestly seen more than that, but it depends on the patient again. I would say that between 20 and 30% loss as far as inches go. And this is really quite fantastic. I mean, it's definitely comparable to other procedures that we do, but you get the added plus that you're also going to have some muscle. Does the patient need a special diet? Not a special diet. No, honestly, that's another thing that I've been surprised about. You know, from the moment I got the machine, of course, that was one of my first questions. Do I need to up the protein? Well, like with any other exercise routine, you definitely want to eat healthy. You definitely want to drop carbs. You definitely want to augment protein, but this is not something that is a must. In other words, I have a lot of patients that are just eating as healthy as they can, pretty much keeping the best diet that they can and doing their exercise as usual, and have still had results. I haven't asked anyone to go on any special diets. I haven't asked anyone to take a protein supplement or anything like that. It hasn't been necessary. But I'm sure that if we do that, we can probably get better results. Okay, another question is, if collagen remodeling is there, why it doesn't work for sagging? Well, like I said, it probably does. It's not a procedure that it has been, let's see, say approved, or that has that is promising for improvement for sagging. On the other hand, I have seen improvement, and it's exactly because of this collagen remodeling. I've seen patients look toner, look tighter, and have better skin quality. So I'm sure it must have a certain improvement on laxity, but because this is not what the machine promises, I'm trying to stay away from that point. But I absolutely have seen this type of improvement. And so if we're talking about that there is improvement in collagen remodeling and in laxity, well, then we're really taking care of a lot of things with just one machine. Okay, but I shouldn't be promising that. Okay, and it seems like those are all the questions. Oh wait, we've got another question here. Okay, if collagen remodeling, what about gynecomastia? Okay, so yes, absolutely. For patients, especially men who want to treat their chest because they have excess body fat in that area. That's actually something that patients have been asking for quite a bit. Absolutely, this is a great indication. They will not just drop adipose tissue, but they will also increment the muscle. So men have also been very happy with this indication. Yes, absolutely, you can use it for that indication. Do we have any extra questions? Let's see, what about sex change patients? So far, I haven't had any sex change patients, but I would say let's evaluate each case. If we have a woman, definitely don't forget that we're not supposed to be treating the chest. But yeah, I mean, I'm sure we could consider this option, absolutely. Okay, so it seems like these are all the questions, unless anything else pops up. It says, thank you so much for the wonderful presentation. Thank you for attending. Thank you for so many questions. I see that there's a lot of interest. Really, just to conclude, I have to tell you that I've been very, very happy with this procedure. We've been doing this procedure since about the end of November last year, and I'm sure it's going to keep surprising us. It's really been such a fantastic addition to my body contouring procedures. Thank you again. You have my email. If there's any extra questions, I'm very happy to answer them through the email. Bye.